Just a short video today about aneurysms, other aneurysms that we deal with. It's going to be short because you don't see these very often, but I'm talking about what they call visceral aneurysms or aneurysms of the intestinal arteries with the arteries inside the abdomen. Now, brain aneurysms, again, are a totally separate issue. That's really not our domain. That is more in the neurosurgery domain. Brain aneurysms, a different entity. But aneurysms in the abdominal cavity can occur. The ones we typically see are aneurysms of the spleen artery, the blood supply to the spleen, so-called splenic artery aneurysms. And then kidney artery aneurysms are probably the other prevalent ones that we see. That's the blood supply to the kidney. Now, normally there's one blood vessel to each kidney, sometimes there's two, but you can get aneurysms of these blood vessels. And again, they're usually found incidentally. You have a CT scan or an ultrasound for another reason, looking for some other problem, and these are found incidentally. That's typically how I see patients. They're referred because of an incidental finding, for example, of a splenic artery aneurysm. Most of these do not need treatment at all. Most of them do not need treatment. There's a subset of people who might need treatment for splenic artery aneurysms. That's premenopausal women, childbearing age. Splenic artery aneurysm may need treatment in that particular subgroup, but most patients who have these aneurysms, whether it's a splenic artery or the renal artery, the kidney artery, do not need treatment. Why? Because they don't have a tendency to grow bigger and rupture like aortic aneurysms, so they need regular checkups. Now, renal artery aneurysms, kidney artery aneurysms can cause other issues like high blood pressure, but it's pretty rare. I'd say, I don't remember the last time I operated on a kidney artery aneurysm. That's 29 years of work. Spleen artery aneurysms, I've maybe fixed one or two. But again, most of these do not need surgical repair. Then there's esoteric aneurysms, superior mesenteric artery aneurysms, celiac artery aneurysms. Again, those are the blood supplies to the intestine. Again, incredibly rare. And again, most of them do not need treatment. Hepatic artery aneurysms, the blood supply to the liver. Again, incredibly rare, really need treatment. And then really strange ones like gastroduodenal artery aneurysms. These, when you have a bunch of these things, they're sometimes associated with certain kind of conditions like polyarteritis nodosum. There's different kind of conditions that are associated with some of these aneurysms, but generally speaking, when you hear or you got a splenic artery aneurysm, it's calcified, don't be concerned, especially if it's less than 2 centimeters in size. It's just generally a very benign condition, can be followed regularly, and rarely, if ever, needs treatment. In fact, I'm going to put a link in this video at the bottom, or in that spacer between where the comments are, that give you a link to the Society of Vascular Surgery white paper on management of so-called visceral artery aneurysms. That's pretty self-explanatory. It tells you that, what to look out for when these things need fixing, but generally speaking, it's pretty rare to need a surgical treatment for these. I think next time we'll progress on to carotid artery disease, because that's always concerning to patients that I see, because that's one of the risk factors for having a stroke. So we'll talk about that the next time.